if I'm joyful, if I'm healthy, if I walk into any room or if I walk into any family, if I walk into any place, am I going to make other people happier and joyful and healthier? That's the motivation which keeps me going. If I lead a good life, if I have good behavior, I'm going to make world around me healthier and happier. And what could be better than that if you have that sense? So ultimately, it's the self-love and loving others. That's the bottom line. That's where the change happens. That's where the transformation happens.
What if the way we live each day is the truest measure of success? Dr. Rock here. As we begin this new year, there's no better time to reflect on what truly matters. And in this episode of The Health Feast, we do just that. I'm honored to welcome Dinesh Chandra, a coach for personal transformation and the co-founder of the Global Wellbeing Network. Dinesh has worked with global leaders and organizations to align strategy and well-being. And his insights stem from a life that is rich in leadership, compassion, and deep personal reflection. So in our conversation today, we delve into the transformative moment that shifted Dinesh's life from a head-focused, goal-driven mindset to a heart-centered way of living. We also discuss his life-changing meeting with the Dalai Lama, where he redefined what it means to be truly wealthy, and the practical tools he's developed to help others design their lives for success. Dinesh shares powerful strategies for creating authentic connections, fostering supportive communities, and bringing well-being into workplaces in ways that go beyond lip service. Along the way, we reflect on how love, purpose, and intentionality can guide us through life's greatest challenges, including those we both faced when our loved ones battled cancer. So, whether you're on a walk, maybe you're commuting home, or perhaps you're winding down for bed, this episode is the perfect companion to inspire intentionality and joy as we step into this new year with Dinesh Chandra. So let's do the show. So Dinesh, first of all, I want to just thank you for coming on my podcast. And I want to start by just acknowledging your presence in my life. And, you came into my life at a very difficult moment, which I've talked about. My wife, I think 2 days after I met you, I found out my wife had cancer. And somehow we just connected and talked because we had planned on that anyway. And then you were just so loving and kind to be there for me and listen and set up times to check in on me. And I thought, I don't even know this person. And he's being so loving and kind. So I wanted to start by just acknowledging that.
Thank you, Rakesh. And I'm just in gratitude for who you are, welcoming you in my life and the work you're doing, this amazing work you're doing and the challenging work you're doing. It's not easy to let go of the nice, comfortable life and go in alternate way of healing. And so more of you for the work you're doing. And it's a pleasure to be with you. Just being with you is just uplifts the energy right away. Every time I'm with you, it feels uplifting. And so that thank you for inviting me on your podcast.
Oh, you're very welcome. Yeah. No, you had reached out to me just recently, I will say. And I said, why don't you come on my podcast? And you said, oh, I'm going back to India in a couple of weeks. And I didn't want to miss out on the chance to get a recording in with you. So maybe I start with thinking about your journey and the impact that you've had and that you're having. And so what moment stands out as a turning point for you?
Well, I'm very inspired by the David Brooks, the book Second Mountain.
Uh-huh.
He talks about two mountains. So there are two separate journeys, and I can describe the two more. Which one would you like to know, the second one or the first one?
Well, we can't get to the second one without knowing a little bit about the first one.
Okay. So the first one, the first mountain was I always wanted to see. Poverty really bothered me. I said, if we are so intelligent, so smart, why we need to be poor? Why can't we be prosperous? And growing up in India and seeing poverty, I wanted to do something about it. So I came to US. It was the man landing on moon, 1969, and I joined University of Miami and did my industrial engineering and with the plans to go back to India. But in the meantime, I met this wonderful girl at University of Miami, and I looked at her and I told my friend that I'm going to marry this girl. And we did get married, and then we did move back to India 20 years later, almost I came to US in 1969 and I went back in 1989. Those 3 years, 89 to 92, were the top of my professional career. I was doing what I wanted to do. In my mind, it was doing a drop in the ocean, but trying to make a difference in creating better productivity, better quality in India. That was my way of giving back and thinking that it'll help eliminate poverty. And those were the best years of my professional life, but the turning point came there when I heard the news at top of my career. I call God as equal opportunity ego buster. So that's where I hear the news that my wife had leukemia and
Mm.
without any treatment, she has 3 months to live. And
Mm.
everything crashed for me. And 2 years in hospitals and a bone marrow transplant and New York's major hospital. And she passed away in November 92. And that was the turning point in my life because that's where, in those 2 years, I went through raising two young girls, 8 and 10 at that time, and going through a kind of a total transformation. And I moved from my head to my heart, and I realized what's important in life. And then that was my first mountain journey. And and then I started doing transformational leadership workshops and in search of who we truly are. And so we'll invite leaders and we'll get a chance to have an audience with Dalai Lama and Chinmaya. Mission was nearby in Dharamshala. So we had those lovely week-long sessions with leaders and hear stories. And they were so healing. And it's interesting, when we give back to the world, my lesson number one, we at least get 10 times, maybe 100 times, maybe infinite, I don't know, but we get so much back. So giving and receiving are two sides of the same coin was the first mountain for me. And then the second mountain
Wait,
literally
wait,
is,
wait. But
yeah,
can I just ask?
sure.
So, well, one, let me just reflect. I mean, you had you have three daughters, two daughters. Sorry, you had two young daughters. They were very young, and your wife passed away.
Right.
How old were you? How old
I
were
was
they?
46 when she passed away.
You were 46, and the kids, the daughters were.
The older one was 12 at that time, passed away. When she became sick, they were 10 and 8, but when she passed away, they were 12
Mm.
and 10.
Yeah, and I didn't know any of this when we first met, but then I remember talking to you on the phone. Oh, we did a video call, and you said, how are you doing?" And I had just found out about my wife's cancer, and my daughter's 12, my son is 10, and I was like, "Whoa, it's crazy that like I met you last week." But sometimes the universe, not sometimes, always, like the universe puts the right people in your life at the right time.
The,
Anyway,
the good
okay.
news is, Rock, good news is, Rock, that now the treatment is much, much better.
Yeah.
And the survival rates are much, much better. You know better than I do.
Yeah.
So,
Yeah. So what can you just take us back to that time, right? I know you said you went from your head to your heart. I can only imagine the profound impact that had on you, but can you maybe expand on that a little bit more?
yeah, I think up to that point, my life was all goals driven and all schedules driven,
Mm.
very linear, I got to do this and I'm going to put all my best and rah, 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 and get it done and so on. After that, that next 2 years were really, the first 2 years were, I kind of just reflected on life and I
Mm.
felt differently. Raising the girls really helped me understand life much better. Because, for example, I would serve them food from the kitchen directly. And when I had a nanny, when she would serve the same kind of food, the girls liked that better. So I asked her that when you cook, they like it so much better. When I cook, they don't like that much. She says, you don't understand. Girls like beauty. So you need to
Mm.
purify the table first. Don't serve them from the pots directly. Set
Mm.
the table up, put some flowers, set a candle,
Mm.
make it nice, beautiful.
Mm.
So I started to pay attention to those things, which before that I had not paid attention.
Mm.
So when you are operating from heart, then I think when you meet someone, when you hear a story, it has a different impact on you. You don't think in terms of how it's going to impact my schedule or what you're trying to get done, what your goal is. In that moment, you go out of time and the time stops and you connect and you learn to live in the moment. So I became aware that I'm not living in present moment at all. I'm living totally in the past, or I'm living in the future worry,
Mm.
or my past regrets, all the mistakes, the guilt and shame. And then slowly I realized that no, life is all about living in the present moment. So I became aware that life is about not about just getting the task done, but living in the present moment. And relationships are a very important part of life. And love goes from our heart to the other person's heart is the most important thing.
Hmm. So that's really speaking to me. And I think when someone, well, in your case, when somebody dies at a young age, or anyone dies, really, when we're faced with the finality of life, when we start really reflecting on, we don't know, we're all going to die, we don't know when, you start realizing, well, what am I living for? Am I living for a retirement 20 years from now? Which I think a lot of us, right? And then you realize, what? There's no guarantee that there's 20 years from now. There's only today. Okay. Well, then you said, just in passing, you just name dropped like the Dalai Lama. I love that. Like there were people there, including. Tell us more about that. You spending time with the Dalai Lama
Yeah,
and.
so that my second mountain journey started. I would say about roughly about 22, 23 years ago. In 2001, we were doing, several of those retreats we used to do. I'd mentioned that. But in 2001, we did one on what is true wealth and how do we create it.
Hmm.
So we had about 60 people and we asked this question with Dalai Lama. So, Your Highness, what does it means? What is true wealth and how do we create it? And the answer he gave really opened up a new pathway for me. And actually, a book came out with the same title. And the Dalai Lama's answer is in that book, What is True Wealth and How Do We Create It? And I put down my story there of how it impacted me. And I created a matrix. I kind of went into hybrid now. I'm again back to my matrix. So I created a matrix for me that the true wealth we all know. The tangible part is very clear is that your assets, your
Sure.
bank account, home, stocks, and all that. But intangible wealth is where I focused. So I identified 10 things I need to do, I wanted to do, or I need to do, and I measured myself where I am on a scale of 1 to 10, and I said, in 20 years, I want to get there where I'm almost 10 out of 10 out of all those 10 questions, and there'll be like $1 million of intangible wealth in my mind. I like
Mhm.
to make the intangible wealth tangible. And now I look back, uh, I find myself aligned with many of those things which I had planned. So I'm really, really grateful to Dalai Lama for his wonderful conversation on that afternoon in April of 2001, I believe. And my life had moved in that.
Yeah, how does one get to do that? Like, what afforded you that opportunity? It seems like.
Actually, you don't have to go anywhere. You don't have to climb any mountain. One of my friends, Susanna Barciela, wrote very nice. She described one of her experiences of going to Dharamshala. But at the end, she said, you don't have to go anywhere. You, you can simply be wherever you are. And if you look at life carefully, and if you look at people who are showing up in your life carefully, and if you can feel a sense of connection, and I always operate in these visual metaphors. So I got this metaphor of anyone I'm meeting, like Rakesh right now, you are my right hand, and
Mm,
Dinesh is my left hand.
mm,
So if you do something or you say something which I find hurtful or insulting or appreciating or whatever, right? I can react to you, but do I react to my right hand? If I'm hitting a nail with a hammer and accidentally I hit my hand, do my hand take, oh my God, I'm going to take revenge? You are
yeah.
such an idiot. Why did you hurt me? Right? But because of that sense of connection, we are very forgiving, we are very accepting. We say, okay, that happened, we understand. So that image actually helps me in learning how I can accept anyone. And, and once you accept people, that's it. Because it becomes so easy to relate to a person. We are all flawed humans. And we are all here looking for that solace, looking for that love. So if we can walk each other home, like Ramdas used to say, that's what I
Mm,
feel is important. Just
mm,
walking each other home, helping each other when we are losing the way, just holding the hand and saying, hey, this is the way. And then others showing me the way. So
mm.
that's what I find my life has become now.
Okay, that's beautiful. Thank you for expressing that. I do want to ask, so if one goes to Dharamshala, not anyone can just meet with the Dalai Lama. Is that like you have to have some connection or with someone? Like, how do you?
You can write to them. There are and you can request an audience. And we were fortunate; we got a time to meditate with him. But it
Okay.
depends. He's very very accessible. If you just write and you can mention that you would like to meet him, then you can do that.
Oh, wow.
It's not difficult.
Okay.
Yeah.
It's not difficult.
Now
Okay.
I don't know now because he is not. He was in New York getting his knee surgery done. So depending on his medical condition,
Mm,
uh,
sure,
that
sure.
yeah only factor. Yeah.
Okay. So that you got that profound answer. That was in the early 2000s.
Yeah.
Where did your life take you then?
Kind of when the girls went to college and then they settled down, I moved to California and met my second wife, and I moved to California. Then I was in Florida for the first for almost 30 years, and then I came to Bay Area. In 2002, I got remarried, my second wife, and I'm here now.
I hear
And she's
you.
an attorney, and life took a second chapter of my life.
Yeah, I hear that.
Uh,
And more recently, you've been working on a lot of initiatives and projects related to wellness and well-being. You want to kind of share a little bit about that?
Absolutely. So I think what happened as I started to connect the dots of my life, the first mountain and the second mountain journey which started, I found that I enjoy working with people where we can help each other transform and change. So that's how the transformational retreats came. And then I started working with organizational transformation. Like here, when I moved to Bay Area, I worked with Cisco and Oracle and several other companies. For about 15 years, I had from 2000, 1990 to 2000, I kept working globally. But then 2000 onwards, I settled down in Bay Area and really working with only few companies in Bay Area. About 5 years ago, that's before the pandemic, 2019 or so, I felt that everything that I connect, what do people really want? Even when they are prosperous, people want to be happy and people want to be healthy. And I think there is a Vedic saying, Sarve bhavantu sukhina, sarve santu nirama. Yeah. Let all be healthy and let all be happy.
Mm,
And that I felt ultimately, almost everyone I have met, they all want to be happy and healthy.
mm,
And I also felt that this is our birthright to be happy and healthy.
mm,
And we can all be happy and healthy. Then why we are not? And
mm,
so many people are not. So then I got into that, and that's where this idea of well-being came. And
mhm,
I was totally wanted to create the well-being centers. And so I said, in California, 5 years ago, we started looking at creating a well-being center where on the weekends people can come and we can have dialogues like this, like I'm
Mm,
having with you now, and we can
sure.
talk about how can we be healthy and healthy.
Mm,
So that physical center did not come, but I had a very good friend, and he had a nice, beautiful home on the ocean view in Carmel. So he invited me about 2 years ago, and he says, "Forget about having a physical well-being center." He says, "Dinesh, wherever you are, just imagine that that's your center, and start from my home. My home is the center." And those words were almost prophetic, because as I look back 2 years later, I mean, I've had these kind of gatherings. Like this weekend, we had two gatherings. One was here in the Villages Golf and Country Club in San Jose, and the other was in the beautiful home of Sandeep and Shanti in Morgan Hill. And about 20 people total, maybe 20 to 30 people joined, some online and some were there physically. And we had such a beautiful conversation, discussions. There were medical doctors, there were PhDs, and we kind of really explored, learned, shared of what does it really take to be happy and healthy, and what does the word happy means. Happy is also a very tricky word. And are we talking about the instant happiness we get by eating an ice cream, or are
mm,
we talking about the eudaimonic happiness we get when we are serving others or when we are deeply aligned with our purpose? So, as you go deeper into those questions, that's where people begin to reflect deeply of what do they want versus what do they need. And that
yeah.
awareness of difference between want and need is very powerful.
Mm. How do you help people reconcile that? Because I think a lot of times people, they have a hard time acknowledging what they need, or, I mean, I think, yeah, what you're describing is people sort of succumbing to instant gratification or pleasure.
Well, one thing I found for sure, there's a old one story I had read about that old man talking to his grandsons about, what do I do? And he said, there are two wolves. I'm sure you might have heard that story. There are two wolves, they're talking to you constantly.
Mhm.
One wolf is telling you, oh, go ahead, such a delicious ice cream. The other wolf is also cautioning you, watch out, what will happen, and so on. So he says, but which one, where do I go? The grandson asked. And the grandpa said, whichever wolves you feed into. If so, in these conversations, I have found that most of the people are aware. But when we sit down, when we take time to discuss and explore and reflect, they come out with that. So one of the doctors, small conversation, she said, well, I hear my inner voice all the time, and I'm now going to pay attention to it. So people out of these conversations, out of these dialogues, and this is my wish in this today's dialogue as well, that if there is one thing people realize, that it's their birthright to be happy and healthy, and that they have a choice. They don't have to be a prisoner to the belief system they are a prison they're living in. They really have a choice. If they get this one thing out of this conversation, I'll be very happy.
Yeah, that a lot of our suffering is caused by what you were saying earlier, our preoccupation with the past or what might happen. And as you're saying, it's a choice that we can choose how to live kind of more intentionally. And is that right? And be happier.
Absolutely, absolutely. Happiness has nothing to do with outside circumstances. That's well known, almost a cliche now, but that it's the state of
It's the
being.
insurance. Yeah.
Yeah, a state of being.
You talk a lot about, or your work is sort of focused on integrative wellness. Yeah, you use that term. How would you define integrative wellness?
Well, number one, we need to have food on the table, financial wellness. If right now, if I didn't have my nice breakfast this morning, I would have hard time. And you, so I think we need to really figure out a way, and where we are financially independent, and at every age, at different kind of things you have to do. So when you're 25, you're educating, learning, and then professional. At 50, you do something else. At 75, it changes. So hopefully these days, there is a group called FIRE, and they're encouraging younger people in my time by 70, 75, if you're financially independent, fantastic. But these days, I find younger people, the millennials and the Gen Zs, they are financially independent at 40,
Mhm.
and they're doing what they want to do. They don't have to wait till 60 or 70 to do what they want to do.
Sure.
So
Yeah, yeah, yeah.
that's number one, the financial wellness. And then comes the physical wellness. Those two are the fundamentals blocks. If you're physically not well, it's over. If you get assisted living or you have a major issue, you can't walk, you cannot talk, you cannot see, life comes to almost an standstill. So those two, I would say, are the most important aspects of well-being. Nonetheless, they are intertwined. So for physical health, Rat, that stress management is one of the key factors. Emotionally disturbed, mentally disturbed, you cannot be physically well. It'll get to you. The emotional stress will get to you. So emotionally, you have to be very, very well, and mental wellness, intellectual wellness, and finally your spiritual wellness. What really keeps you going in most challenging hours? That's where your spiritual wellness comes very handy. And spiritual wellness is the one which helps you change and transform and so on. And on the external side, these are the internal factors. On the external side, yes, you are financially doing well, but then you have to have a social circle, your friends. And if you read about the blue zones or if you've seen the document, the number one factor is the support system, the friends you have, the
That's right.
social systems, right? And then, of course, professionally, what you have done. Are you feeling aligned to your purpose? And finally, the environmental, and which is we are so fortunate in California to live under the blue sky and still able to see stars, especially in Yosemite. But many parts of the world, you can't, it's so polluted now. So, external environment, not only physically, but also what kind of people you are surrounded with, how you feel, what kind of audience you are dealing with. All those factors are important. So if you integrate all these factors, internal versus and external, I call that integrated well.
Mm,
Actually, the better word is well-being. So we use
sure.
more and more Global Wellbeing Network, which is also my company, and we have a team of about 15 people, all committed to making this world healthier and happier.
Yeah, what are some of the initiatives and programs that you're doing at your company?
Well, we are working with corporations who are genuinely, more than paying the lip service about, employees' well-being. So, and we have this model of 4 levels of maturity model, 4 levels of well-being maturity model. So, level one, you're primarily concerned with safety and physical safety and emotional safety, creating that space in your organization. And level two of maturity model, you really care about employees' well-being. So you're offering fitness, you're offering yoga, you're offering mindfulness training, and so on. Everything to do with employees' well-being. And then level three of maturity, you start talking about the workplace itself. How can you create a healthy workplace? And the level four, now you're talking about the healthy organization, creating a culture where people don't get caught up in the ego conflicts and helping people actually lead what Maslow called self actualization, the compassionate leadership. How can we operate at a level where we are helping employees really living a life of higher consciousness and call it a compassionate leadership,
Mm.
and so on. And there are a few organizations, not too many, but we are hoping that the work we are doing will help increase those number of few organizations to many and will make an impact on the world. Because the corporations are very, very powerful in terms of impacting our world.
Yeah, and how incredible it would be. I'm just thinking to be at an organization that prioritizes all of those things. Very few prioritize even basic, or they do a lot of, like you said, lip service for basic wellness, but to have profound investment in the well-being of the employees such that, reach this highest level of self-actualization. That is a Such a noble a goal for our society to have corporations sort of looking at the people that work for them, with such care for their well-being.
And Rag, the good news is that there are some. I'll give you one which I work very closely with, and I spend some time with them. It's a Karma Lakeland resort, and it's a number one eco resort in India, right around Delhi Airport, International Airport, about 25 miles in Manesar, Gurgaon area, and it's a 270 acres of property, and forest in the middle of concrete jungle. You'll find this deep forest, and there are about 300 employees. And I'll just give you one incident of the compassionate leadership. The owner, the founder of that, Ashwini Khurana, when during the pandemic, he his employees were getting concerned because they had zero customers coming to their restaurants, hotel. Everything was almost shut down in the beginning of the pandemic. And a lot of organizations lay off people. But he announced that as long as there is fire in my kitchen, there will be fire in your kitchen. And employees are so grateful to him. And he took a lot of negative cash flow during those pandemic years or so. But imagine how his employees feel today. And so that's to me an example. And now, if we are always into the short term profit, maximizing this quarterly output, then of course there is tremendous pressure and we create conditions for burnout,
Mm,
which I think in Bay Area is known for that.
mm,
Organizations, even if they don't have any economic issues, simply to keep employee on their edge, they would have these Christmas layoff, and timing couldn't be better. Right before Christmas, because they feel that 10 days is wasted. Right, Christmas to New Year's, a lot of productivity is low, so lay off people right before
oh
Christmas.
boy, yeah.
How and only to keep fear in the organization. So the motivators have been fear. We are suggesting why not change that motivator to inspiration. People perform much better when they're operating from inspired leadership, compassionate leadership, and not controlled and fear and perform. And if you are in the
Yeah,
bottom 5%, you'll be laid off. So it's a
yeah,
different paradigm. It's a different mindset. And that mindset leads to more fear, more worry, more dis-ease, more, and this mindset leads to more wellness, and the founders also feel good. Imagine you are making an impact in the lives of a couple of hundred people, and in Bay Area organizations, it could be in thousands. And so, imagine how you would feel when you're making an impact in the lives of so many people.
yeah.
Very, very rewarding.
Do you do you ever encounter any sort of resistance when you're introducing kind of wellness practices into an organization, or is it? Yeah, I mean, what is
Right.
that experience like?
This is the funny part. They all acknowledge and they all agree it is the right thing to do. But I think the challenge comes to put your money where your mouth is. And it individually also had the same thing I found. Individuals, I mean, I have hardly met anybody who does not know what he needs to do. They all know I need to cut down sugar. I need to change. I
Mm,
need to exercise every day. They always tell you, yes, I know. The challenge is they're not able to do it because we are so caught up in our short term mentality
yeah.
that we never are able to really convince our deeper self to listen to our deeper voice.
Mm,
That is the that is the challenge we humans feel all the time.
mm.
We are tempted into the short term. What is your take on that, Rob?
Yeah, I think in golf they talk about. I don't play golf. Do you golf?
I do. I do.
Yeah, well, I think I'm gonna totally butcher the analogy, but they talk about the short game and the long game, and in golf, right? Because you have your like putting and your
Right.
Well, I just think of the short game and the long game in life and in your habits, right? And so bad habits, like unhealthy habits, they have a very strong short game. Like they feel really good in the moment. And they, like you said, they they're pleasurable, but they have a terrible long game. Like in terms of the long term, you know, that's what's causing disease. If I eat pastries every day, I'm gonna get affected by that. So it's a terrible long term. And then sometimes I think healthy habits. Now I want to counter this, but healthy habits, people assume they have a bad short game. Like they're like, oh, I gotta eat this salad. I gotta. Of course, they have a great long game because if I do these things regularly, then it's gonna lead to health in my life. So this is where the engineering, and I want to talk about this with you because you talk a lot. I think you feel this way that you can really engineer these behaviors in a way so that you're priming yourself to be more successful or you're setting yourself up to be successful. And this is where I think people need to look at the short game of their healthy behaviors and they need to ask the question, how do I make this fun? How do I make this enjoyable? How do I make this a feast? And then, you're not going to feel as many people feel restricted or deprived when they start giving up the things they actually want.
Yeah.
That's I think the mentality that people get stuck in. They're like, I actually want that thing and I can't have it. And you know how we respond to rules like that. I can't have that. Oh, then I definitely want that. Right?
Absolutely.
Yeah. So
The
I don't know how you actually have a whole program where you help people change their habits and behaviors. I was lucky to go through parts of it when you were just sort of constructing it for facilitators. And so talk to us a little bit about how you help people change their habits.
Well, you're right on. You being a medical doctor, Rock, you know very well. And actually, if I remember correct, was some of the things motivated you to follow this because you saw the uselessness of just keep prescribing the medications
Yeah,
rather than now
that's
you're
right.
working on eliminating the root cause of the problem.
That's right.
So I think once people realize that if they eliminate the root cause, then it's gonna make a whole difference in life. So we call it well-being engineering. And well-being engineering is designing for success. So I'll give you an example. If you find that you can't handle chips because at 9 o'clock you have this great urge to have chips, right? All right. Don't
Yes.
buy chips.
Don't buy
Don't
chips.
chips
Don't bring them in the house. Yeah.
exactly. Buy lots of pistachio, buy lots of nuts, buy lots of seeds, and buy a lot of fruits and your favorite fruits. You know,
Favorite fruits. Yeah.
exactly. That's where the design comes. Designing it for success and display them all over the place. So every time
Uh,
you're passing by, you're feeling hungry. There is your favorite orange,
um,
or there is your favorite grapes, or there is your favorite apple. You know, and I almost challenge anybody, even though I put a disclaimer. It doesn't work for everyone, but it has worked for so many people I've tried. I have seen Rock the A1C coming from 7.5 to 5.5 within a month. Can you believe?
yeah, yeah, I can believe it. Yeah.
Medication stopped after that.
Yeah.
And simply, I offered them 3-color smoothies. I said, make the which color smoothie you like. So make it fun, make it
Yeah.
joyful. So the morning
Yeah.
smoothie is green
Yeah.
smoothie, spinach, carrot, and make it very interesting.
Mm.
And add to make it delicious. You can always use dates. We started using dates for people with sweet tooth. If you really have a
Oh, I do that. Yeah. Yeah. I call it methadone for sugar.
And every city I'm in, I'm talking to the local vendors, and like here in Bay Area, Rangoli. So I talked to Paul, who's the owner of that, and he's making dates laddu now. So go to Rangoli and
Yeah.
buy
Yeah. Yeah.
in Kanpur, where the city known for mithai and the sweets. And we are still searching for a vendor who would be willing to make dates laddu. Can you believe that? Hard time finding one, but I'm sure we'll find one. So the idea is that if we keep designing for success, designing for well-being, fill your home with all that stuff which you like. So it's not a burden anymore, like you said, Rock. So it's a
Yeah.
pleasure to have green smoothie in the
Yeah.
morning, purple in the afternoon, and red in the evening. Strawberries, blueberries, blackberry, anything. I mean, sky is the limit. We are so blessed here in Bay Area that all these things are accessible,
Mm.
easily accessible and within
Yeah.
our reach.
Yeah. No, I love that. I think that's the ticket. That's the way to that's the way to make the change, is to really, like you're saying, actually have fun, enjoy it, but also go in with curiosity. One thing I tell people is you don't have to know exactly how you're going to make these changes, but you have to believe. You have to believe that there is a future where you will like different things. You will feel very satisfied by them. And yeah, and your health will benefit from that. And so if you believe that, then you go in with an open mind. You go in with like, oh, let me try this smoothie. Let me figure out how to make this smoothie so delicious for my liking so that I want to have it every day, right?
Absolutely. But now
Yeah.
let's go a little deeper. We also found, we actually learned from Alcoholic Anonymous, I think, and Blue Zones, the having a support group is
Ah,
very, very powerful. But where do we find 10 or 12 people who are like-minded people, and they bond together, and then they help each other? So that's where I started doing this work on the weekends. So on the weekends, we'll meet, we call them communities of well-being. And in India, we call them cows. Uh, COW,
I love
communities of
it.
well-being.
Yeah.
So that, to give you an example, this weekend we had one, like I said, on Saturday in San Jose, one on Sunday. And out of those communities of well-being, what happens is people, when they're leaving, they generally have identified one habit. If they could change that habit, then it will have a major impact in their life.
Yeah.
And if they're successful with that, it becomes very transformative.
Yeah.
How they are able to change the lifestyle. Now it gives them the confidence. So we have developed this 12-week program called AHA, which you participated, Rock, when we were doing the pilot. Uh, and we are so pleased with that, because in corporate environment it works extremely well, because what happens is that once a corporation commits, once a leader commits, then people begin to show up every week. We meet for 12 weeks, because for change to stick, for sustainable change, it has been observed that you need about 3 months. That's where your habits became sustainable, and they take roots
Yeah.
in your mind.
That's right.
So we offer this 12-week program, and every week we provide some inputs. And but the best part of it is that the bonding, the emotional bonding between those 10, 12 people that happens, and that the love that flows, that is the powerful thing that, because ultimately love is the biggest force in the universe. And
Yeah.
I'll give you a simple example. You want to go for a walk in the morning, you're not able to go. You make a deal with your friend, hey, come over, we'll both go together. 6 o'clock in the morning, your friend knocks. Would you go or not go? So it's the friendship, it's the love.
Well,
And
yeah.
you will go, and you'll not go as a burden. You'll enjoy it.
You'll enjoy it.
You'll have
Yeah.
a nice conversation. So I encourage people to either find a partner for whatever you're trying to develop, or join our program. We are launching this program on October 15th. We keep doing it every few months. So we try to get like-minded people who can support each other. They bond each other. In corporations, it's very easy, but in community circles, when we do these communities of well-being, then we get people to come together, and there also they can do. Or we also offer this online program, Amazing Habit Adaptation. We call it AHA.
Aha.
Yeah.
I don't think you had that name yet when you did the pilot. I love that.
Right. This came thanks to one of our team member, Mani. He came
Yeah.
up
Yeah.
with
Yeah.
this.
Yeah. Yeah.
Remember Mani Kantan,
Yeah.
right?
Of course. Of course. Yeah. Oh, that's cool. So, yeah, is the idea that over 12 weeks you're engineering a behavior, you're refining it, you're figuring out how to make it stick, as you said.
Absolutely. You also try to find an answer of why. Why do I want to have this change? And then you begin to see the vision of what you'll be able to do if you stayed with that change, and what will be the price you have to pay if you did not stay with that change. So all those deeper emotional aspects, once they came on surface, I'll give you an example. I have a friend. He is very concerned about avoiding assisted living. He's an avid golfer, but to the degree that he had told his daughter that if anytime you find me getting to that assisted living, take me to Switzerland, and euthanasia will be his preference rather than going through the. I mean, you can imagine, uh,
Yeah, sure. He's being dramatic, but he really,
exactly.
really, really doesn't want to go to assisted living. I hear that.
So when I sat down with him and we exchanged data, and and I said, "You tell me now. You are a scientist. Which is a better probability of you completing your 18 hole and then and dropping dead, or going through the assisted living or going to Switzerland? Which lifestyle would give you better chance of that?" And that helped him really adopt the new lifestyle. And he's now on, believe it or not, on plant-based whole food, and doesn't take oil, doesn't take
Mm.
dairy is cutting down almost, meat is cutting down only on fish, but amazing transformation. So
Mm.
this was
I love it.
avoiding your fear of that. Now, I'll give you one more example. I have another friend, and he wanted to lose a lot of weight, 30, 40 pounds. And we found out as he explored deeper and deeper that his real desire is to travel around the world. And he said, I can't travel like that. I can't hardly walk. And how can I travel around the world with this kind of weight?
Yeah.
It became inspiration for him. So we created the vision that keep. I told him to put pictures with all the places he wanted to go in his room. Look
Ah,
at those pictures every day,
wow.
and that is working very well.
So amazing. Wow. So healthcare is so interesting what you're doing. I want to say healthcare works the exact opposite. So, right, I'll tell you what I mean. Healthcare focuses on the circumstances, the current circumstances. So you come into the doctor's office to say, "Oh, your blood pressure's high." Oh, you come into the doctor's office, they'll say, "Oh, we got your labs back and your blood sugar is high. You have prediabetes. Your weight is high," whatever it is. And then they say, "Okay, now because of the circumstances, you have to do this. You have to eat healthier. You have to lose weight. You have to take this medicine," is usually what they tell you, right? People leave. Why do they have those circumstances? I like to think about that, and it's usually because they're stressed. There's a lot of things going on in their life. They're overwhelmed. They don't know how, they're not taking care of themselves, and no one has talked to them about how to prioritize that. No one still has talked to them about how to prioritize that. So they go home with more chores to do. They already had a lot going on. Now they're told, yeah, you have to eat healthier and exercise, which they don't know how to do. You have to take these medicines. They take the medicines. They don't feel better. The medicines don't actually treat the disease. They just manage the symptoms and the numbers. And then they're exhausted. The whole thing is exhausting. Now, what you're describing is you say, okay, well, let's start with the aspirations. Let's look at not your circumstances, but your aspirations. What is it that the life that you want to live? What is it that you want to accomplish or create in this world? That's what I was hearing. I was hearing, I want to travel, I want to be independent. And then what are the behaviors that are going to get you to that aspiration? And then you know what? The circumstances change.
Okay.
So it's like almost like a top-down approach as opposed to this bottom-up approach in healthcare. And I don't know if you've ever thought about it in that way, but yeah, that's how I
No,
think
no,
about it.
you articulated it very well, and I totally resonate with that. In fact, the only thing I would add is that what I've discovered is that people basically have hard time loving themselves. So, because the best way, if you, so you have, people are in guilt, people are in shame, they are kind of punishing them. And once they can transcend all that, once they can go into their deep subconscious and make it conscious and realize why they are choosing this life, they have a choice. They don't have to go through this punishment, constant punishment. They have to love themselves. And it's
Yeah,
very simple. Like in an airplane, when something was wrong, the first thing is you take oxygen yourself.
that's
And
right.
when you take oxygen yourself, you can help others better. So
Yeah,
if I'm joyful, if I'm healthy, if I walk into any room or if I walk into any family, if I walk into any place, am I going to make other people happier and joyful and healthier? That's the motivation which keeps me going. If I lead a good life, if I have good behavior, I'm going to make world around me healthier and happier. And what could be better
Mm,
than that? If you have that sense. So ultimately, it's the self-love and loving others. That's the bottom line. That's where the change happens. That's where the transformation happens.
that's where the
This
change
billion
happened.
dollar, multi-billion dollar industry, you can keep buying gadgets after gadgets. You keep buying apps after apps. That some of them are successful, but major, if you want 80-90% success, love is the way.
So how do you, yeah, because I think there's a lot of underlying beliefs that people have and things that they're doing that are very contrary to loving ourselves. Yeah. And so how do you help how do you help one make that change that relationship with themselves?
As people begin to have a authentic dialogue, and that's what I discovered that about 32 years ago. When people feel safe, when people feel connected, so there's retreats I talked about, people used to come and then slowly they'll open up. And it used to take us 3-4 days of getting to know each other, opening up. What I'm finding is that if you create a safe environment, it doesn't have to take 3, 4, 5 days. Right now, when we do our weekend retreats, within hours, within couple of hours, people bond. People are yearning for authentic dialogue. They have had enough of conversation in these social occasions where people talk about their big homes, or the people talk about stocks and how they
Sure.
travel, the social
Yeah.
media, all the showbiz kind of things, right? How great my life is. And yet they're suffering inside. They're hurting for relationships, or they're hurting for health, or they're hurting for financial. And financial, there's no end. When you have 10 million home and your neighbors, had a 20 million, so now you need to have a bigger home, right? It's insatiable wants. But once you understand what you need, we need very little. All we need is a little bit of love and a little bit of food, and then we'll thrive.
That's okay.
But
Agreed. Well, we need some sunshine and some movement and I
of
agree.
course,
I agree. I agree. Wow. So you're living in the Bay Area, but you also go quite a bit back to India. Is that right?
yeah, I think I'm so thankful to my friend Shankar, because he said, Dinesh, wherever you are, that's your center. Don't worry about building one. But lo and behold, we are going to launch the first one in Orlando, about an hour drive, Esmina Beach. In March of next year, we are
Cool.
launching our first well-being center, and the idea is to have these kind of dialogues over the weekend, and have people come in, develop, talk about their habits. Most important, many people find, especially if there's a couple, if one wants to adopt a new lifestyle, the spouse does not agree, it will not work. Both of them have to adopt it together. So, what we plan to do is to have these centers and have cottages there. People can come and then they can adopt the new lifestyle. They can get it for it. They stay there for maybe 3 weeks or maybe 3 months. And when you feel, I'm done, now I have the new lifestyle, it's sustainable,
Mm.
then go back.
Oh,
So,
that's really cool. So it's
yeah.
going to be a place you can go stay at, learn, adopt new lifestyles. If you want to change your diet, for example, you're going to learn probably how to cook that
Yes,
food and eat that food regularly. And your environment, I think you were just expressing that earlier, like really the importance of controlling your environment. Don't bring the chips in the house. There are not going to be any chips at the Wellbeing Institute.
only a strawberry, blueberry.
And blueberry chips, apple chips, yeah, banana chips. That's that's amazing. That's amazing. So that's really like going to be an immersive experience for people who want to change their lifestyle.
Absolutely, very well said. And I find that places like that are there. And my favorite is, of course, in Coimbatore, Vedigram, where you can go. Actually, you can own an apartment there. Dr. Ram Kumar runs that near Coimbatore. And we are planning to have many like that. But it's like going to be a franchise someday. So, first one coming up in Orlando, the second one in Karma Lakelands, I mentioned. My friend had said, Dinesh, next year we'll launch there. So I'm hoping that we'll start the second one in Delhi, third one in Bay Area. We have some friends who are exploring the possibility of creating that here. So from starting 2 years ago, now we have the first one coming up, and hopefully soon we'll have many of those, and people would be able to change their lifestyle and not be a slave to their habits, rather be a master to their habits,
Mm,
and
mm,
change their habits as well, like you so well said, that we can actually design the life we want to live.
mm. Beautiful. Yeah. Okay, Dinesh, we ask one question. My co-host is not here today; he couldn't make it, but we always ask this. That's why when I say we, speaking on his behalf, we ask this one final question to all our guests, which is: you're coming to our health feast. We're having all our guests come to this proverbial health feast, and everyone is bringing their life philosophy or mindset tip that can just bring one. What is Dinesh Chandra bringing to the health feast?
I'm saying that every morning when you wake up, you write down on the left side, poor me, all the things which are worrying, bothering you. And on the right side, you say, lucky me. And the top of that list is, I'm alive today. There are 300,000 people who are not going to make it. I'm one
Mm,
of lucky ones who are alive. And then write down three things you can do today to make a difference. And
mm,
at the end of the day, even if you were able to do one or two, you have lived a wonderful day, a bonus day of your life, which you can be proud of. And you can, say, well, I lived a good day today. And keep creating these good days. And then your life will be fantastic. I would urge all your listeners to, after, if in this hour, if they can just take one thing, one habit they want to change, then just focus on that one habit and work in the next 12 weeks, either by yourself, with a friend, or you can always sign up with our program if you need help. So we are here to help you. And Rock, it's always a pleasure
mm.
to be with you. You articulate things so well.
Oh, thanks, man. Just we do a fist bump to the
Okay.
camera. Just give it a little fist bump.
Okay.
Boom. Yeah, boom. Okay. All right, man. No, you just have, like I started saying, like you just have this amazing, wonderful presence. It's been a wonderful energy in my life. I always look forward. I mean, I wasn't. It's been a while, but when you reached out, I was like excited to take your call. I was like, oh, yeah, Dinesh was calling me. I'm so excited. So just spending time with you is uplifting for me as well. It always is. I always feel uplifted after our conversations. So I'm super grateful for our relationship and our connection. We were connected by a really good friend, Jay Chodogom. Jay has been on the podcast early in the podcast. Actually, I think it was our first guest.
Now, Jay is
Anyway,
amazing. Yeah. And I'm so grateful to him for bringing us together,
that's
because,
right.
Rakesh, you are doing amazing job of letting go of all whatever you learned for so many years, and now
That's
learning
true.
new things. and and
That's
and,
true.
and this is real help, because you are helping
Mm,
people eliminate the root cause and live their life to the fullest.
mm.
So my hats off again to you.
Ah, thank you, man.
Keep doing the good work.
Thank you. So appreciate it. All right. And for our listeners, you can check us out at thehealthfeast.com and you can leave a question or comment for me or Poe. And please, on your favorite platform, Apple, Spotify, leave a review if you love the podcast, 5 out of 5 stars, and subscribe and share the podcast. We will see you back here next time. Until then, live well and rock on.